Can hip opening yoga poses create micro injuries in the hip joint that may set us up for serious issues down the road? Hello, this is Eva Nolik-Smith, founder of Yoga U Online and the Yoga and Health podcast. In this talk, yoga therapist and physical therapist Dr. Ginger Garner talks about common pitfalls and problems she has witnessed in her work with clients, particularly as a result of hip opening yoga postures. Learn why these injuries happen, who are at greater risk, and how to stay safe in your yoga practice. Thanks for joining us.
It is a wide range of issues, and that's why diagnostics of the hip can be difficult, because you need to branch specialties in multiple fields. So in order for me to practice as a specialist with the hip, I also need to be a clinical specialist with pelvic pain, which is a whole other range of postures. So if we look at how we might create that safety net and look at why people are having these injuries, because I have had a lot of people with yoga-based injuries, is to look at it from a biopsychosocial perspective, where there are certain physical components that we definitely want to address through a physical screen. Mm-hmm. But there are also intellectual, spiritual, energetic components that we may think of as the softer side, the more philosophical side, but sometimes it's those pieces, the language that we use, that we end up falling back towards a dominator model of kind of guru as God and white power of the white coat syndrome type issues, where we use a language that is authoritarian instead of collaborative. And language like push, pull. I really, when I'm teaching therapists how to develop their own language, their poetic language, which is not overly clinical and antiseptic, I talk to them about not using those aggressive words. And I think teachers need to consider that also. Mm-hmm. Things like hip opening. I've written a couple of blogs on that. Yes. That I do wish teachers would recalibrate the language that they are choosing and realize that every word counts. If you tell someone to press their knee into their chest, guess what they're going to do to their hip? Mm-hmm. And if they have any indication of whether it's sacroiliac joint dysfunction, or maybe the TFL or the sartorius or the IT band is not functioning as it should, it can get caught up in the mix of hip impingement as well. There are so many different variables, and all it takes is for a teacher to say, press your knee into your chest to do that. So ditching some of those cues would be really helpful. Right. And instead of pressing people to say, push further, or if you feel good, then go a step further, is to do some type of observational screen that you would lead students in, or whoever it is that you're working with, where you can say, we need to find a healthy limit, and it's not about flexibility. I try not to even use that word anymore. I don't, when I'm teaching and I'm working with a patient, I rarely say flexibility. I don't really use the word stretch. I also don't tell someone they're tight either, or that something is, you just need to stretch that out. When I first searched on Google hip opener, I just wanted to see what was out there. And there was nothing on the entire internet that was addressing the negative aspects or telling the cautionary tale of hip opening, which is when I decided somebody needs to say something. Right. And that if we can adjust our language to a more nonviolent, collaborative language that empowers the person instead of the teacher being some kind of guru to push them into a situation, it could greatly improve our yoga outcomes. And some of the backlash that the yoga community is experiencing because of these extreme postures that are taught can be ameliorated and improved.
Yeah, it's a beautiful point you're making about the effect of languaging around it, because certainly hip opening sounds like something very desirable, and so you wanted to push a little bit extra to get that really nice open hip
Right.
that is presented as a goal, which it probably isn't necessarily even for most people. They have the range of motion they have, and that's the end of it. So
It is, and when I'm teaching postures in any setting, but when I'm teaching healthcare providers to use yoga, I use something that I wrote about in my book called a vector analysis. And the first part of that is making sure that you've identified the optimal kinematics that a person has available to them. So automatically, if someone comes into yoga class and they have less than optimal kinematics or structure of the joint that you're addressing, you already know you're going to have a more difficult time with the rest of the analysis. Mm-hmm. The next part is efficient motor patterning, not just firing a muscle, because we know that a brute lift using the bicep can end up hurting the back. So it's not just about brute force. Mm-hmm. It's about the most optimal patterning or efficient motor patterning possible. So if someone comes in and they have osteoarthritis already and they're feeling that, then you're going to have, you're layering up challenges for that individual. So the last thing we want to do is just say, do warrior 2 like this when we don't know what the structure of their mm-hmm. joint is. So then we work on motor patterning. We back out of the range and we work on efficient motor patterning. Mm-hmm. While we're doing that, I have a lot of people, and I've worked with a lot of healthcare providers who have genuine, almost PTSD-like experience from being in a yoga class and being pushed. Or even maybe they're in another form of maybe gymnastics or something like that, where they have been pushed by a coach or the teacher to do something that now movement is scary. Mm. Movement is something that they fear. Mm. And we have to get that trust back. As you know, if you lose trust for anything or anyone in a situation, you just can't get that back automatically. Mm-hmm. That is sometimes harder than neuromotor, neuromuscular patterning. Let's say someone has a hip injury. Let's go back to the osteoarthritis example. They have OA. They know kind of how the progression happened. They're working on it. They're addressing nutrition. They're a little fearful of movement, that they really want to go to this cool yoga class. They get in the yoga class. They know they're weak in certain points. So we know motor patterning is a little off. We know they have some fear that automatically affects what happens and their outcomes. And then the last thing is, how does the tissue respond? Mm. From a fascial perspective, from a neurovascular perspective, and this response of the skin in general and the other soft tissue. So that's 4 parts of a vector analysis. When someone comes in the door and I want to teach them Warrior 1, I have to look at all those things.
Right.
And then use language that is partnership based. That is me not saying, I'm the doctor and you have to do what I say.
Right.
No. Is to be collaborative with them, to help them and empower them to say, I'm in charge of my healthcare, and I'm in charge of my yoga practice.
Right.
So that's my job, is to make sure that they don't need me anymore, that they don't come back with another injury. And that's kind of the crux of what we're getting at.